term's fixative is basically formalin mixed with an appropriate quantity of phosphate buffer. Ordinary formalin can slowly undergo oxidation reaction to form formic acid, which then makes the formalin acidic with a pH of 3 to 4. So in order to counter this change in pH and stabilize the formalin to a more or less neutral pH of 7, phosphate buffer is added to the formalin. The use of neutral buffered formalin against ordinary formalin as histological fixative and also as preservative has gained popularity over the years mainly because formic acid present in ordinary formalin can easily react with the hemoglobin of blood to form acid hematine, which greatly interferes with histology studies of animal tissues. This is overcome with the use of buffered formalin. Ordinary formalin being acidic can also react with the calcareous structures of certain groups of organisms with exoskeletons, and thereby cause gradual disintegration of such specimens when preserved in ordinary formalin. For all these reasons, buffered formalin is probably the best option when it comes to wet preservation of specimens. Having said that, I've seen specimens over 50 years old and some even close to a century old being preserved in ordinary formalin and still keep their structural integrity to an appreciable extent. These specimens are mostly mammals including fetuses, reptiles, birds, fishes, and even certain arthropods. I even have in my very own collection a 3-month-old human fetus from the 1970s, which was and still is preserved in ordinary formalin. This fetus, which goes without saying is obviously delicate to begin with, seems to be holding up pretty well in the acidic formalin. In fact, almost all, if not all, of the commercial wet specimens sold for academic purposes in my country